Hello, everybody, and welcome back to Sociology 110. Today, we're going to be discussing health and migration. And we're going to begin today with the story of this amazing woman, Cubana Juana Batista de la Candelaria Rodriguez. She claims to be 127 years old. Unfortunately, it's impossible to verify this because of the lack of records in her native Cuba. But if she is 127 years old, she would have beaten the record kept by Maria Gomez Valentim of Brazil, another Latino woman. Though we cannot verify the age of Mrs. Rodriguez, we can ask an interesting question. Does life expectancy vary by racial or ethnic background? Let's take a look at some data from the Kaiser Family Foundation for three groups: non-Hispanic whites, Hispanics or Latinos, and African Americans. Now, as I mentioned last class, life expectancy for everyone has increased dramatically over the past century. So it shouldn't surprise us to see that most people today are living fairly long lives. For whites, life expectancy is about 78. For African Americans, it's substantially lower, 73. And for Hispanics or Latinos, it's 82.2. So substantially higher. So why is this? What I want to talk to you about today is why Hispanic or Latino people in the United States tend to live about 4 more years than white non-Hispanic people. And you may say, okay, mortality is a fairly crude measure of health. What about all the other types of conditions we might care about, such as cancer or mental health? Well, let's look at some of that data. This graph shows causes of death for whites and Latinos. So in the gray dots here, we see the general US population. The green dot is the white non-Hispanic population, and the yellow dot is the Hispanic and Latino population. And here we see the prevalence of different types of health conditions across these three groups. So if we look across almost every single category, cancer, heart disease, unintentional injuries, everything really except for diabetes, chronic liver disease, and homicide, it looks like Latinos have lower rates of disease than non-Hispanic whites. Why is this noteworthy? Well, we spent our last class talking about the very strong relationship between SES, which we defined as socioeconomic status. That's the measure that sociologists often use to describe people's economic, class, and occupational position vis-a-vis others in a society. And we looked at the relationship between SES and health. And I told you that SES is among the strongest predictors of health. We talked about how 8% of health disparities can be attributed to individual factors such as diet, exercise, and smoking, but a staggering 30% can be attributed to socioeconomic factors such as class, race, and education. And this is a big source of racial disparities in health. So we just saw that Latino and Hispanic populations are overall more healthy than non-Hispanic whites. But this chart shows staggering health disparities between African Americans and non-Hispanic whites. African Americans are 20% more likely to suffer from depression, 40% more likely to suffer from stroke, 40% more likely to be obese, and 40% more likely to develop breast cancer, among other conditions. The same is true for African American children, who are 2 times more likely to die as an infant than whites, and 3 times more likely to die from asthma. And if you're interested in learning more about race and health, I really highly recommend you check out Dr. Tyson Brown. who is one of the most exciting professors in the sociology department, in my view, and is really doing excellent work in this area and teaches a wonderful class called Who Gets Sick and Why. But I'll go out of promotional mode and let's get back to the subject at hand. Racial disparities, like we were just looking at, are not the subject of this lecture. Instead, we're asking why Hispanics and Latinos are generally healthier than whites. Nevertheless, the comparison with African Americans and non-Hispanic whites is telling because Latinos and African Americans have very similar socioeconomic statuses. So if we look at the general US population, we see that about 8.5% of the population is living below the poverty line, which is a measure set by a variety of government organizations. If we look at the white population, about 11.1% is living below the poverty line. But for Hispanics and Latinos, it's as high as 1 in 4 people. So judging by what we learned last class about the extremely strong relationship between socioeconomic status and health, one would think that Hispanics and Latinos should be much less healthy than whites. And there's yet another reason why we might expect Latinos to be less healthy than non-Hispanic whites. Latinos are about twice as likely as the rest of the population to be uninsured. And on Monday, last class, I mentioned that a lack of access to care, and specifically information about how to avoid negative health behaviors, was one of the key quote-unquote fundamental causes of socioeconomic disparities in health. In other words, Latinos in the United States are more healthy than other ethnic groups, even though they are much more likely to be poor and much more likely to be uninsured. And this is what has come to be referred to as the Latino health paradox within sociology and public health. The idea that Latinos are consistently among the most healthy groups, even though their socioeconomic status would lead us to expect otherwise, and particularly when we compare Latinos to other ethnic minorities with similar levels of SES, such as Americans, is what's at stake here. So how do we explain the Latino health paradox? Well, like we always do in this class, we're going to try to develop some theories, drawing upon the sociology of health, which you can learn a lot more about if you elect to become a med-soc minor, or if you pursue just broader coursework in public health. Remember that the MCAT now considers social disparities in health one of the key areas that students should be prepared for. Well, today we're talking about a fundamental issue in social disparities in health. And one of the key hypotheses that's been presented to explain the Latino health paradox is a hypothesis we often call the healthy migrant hypothesis. And the idea here is fairly simple. What if most of the people who migrate, say from Central America to the United States, are healthy, like these young men who are leaving Chihuahua City, Mexico, in the 1920s to work in the Bracero program in Texas? This is a guest worker program that really helped propel American industry and farm workers in the early 20th century. So in other words, if only the healthy people are sort of fit enough to make the journey, then this might explain the Latino health paradox. It's a kind of selection bias. Remember selection bias from one of our first lectures where we talked about how sociologists study the world, the sort of methods that we use? It's really a sort of an issue of whether or not the population that comes to the United States is non-random. In an earlier lecture, I gave you the example of studying crime without studying the people who are in jail, because it's often difficult to survey or study people who are in jail. But if we don't study people who wind up in jail, even though we learned in a recent class that jail is also a very non-random experience when we look at the population, and African American men without high school degrees are much more likely to wind up in jail than other groups, we would still wind up with a very ungeneralizable explanation of why people go to jail. So similarly here, what if it's the case that from a population of a country like Mexico, what if only certain types of people feel healthy enough to migrate? It's a difficult journey to enter the United States, especially today, and lots of people die along the way. And maybe only the healthiest survive. And this might explain why, you know, so many of the people who wind up in the United States are healthy, simply because the healthiest people were making the migratory journey to the United States. So that's our first hypothesis. The reading we're going to check out after this lecture is going to go through each of these hypotheses and sort of evaluate each one for us using some pretty cool data. But for the rest of the lecture today, we're going to go over the rest of the hypotheses, and I'm going to be introducing all of the social science theories that help us make sense of the so-called Latino health paradox. So our second hypothesis here is the idea of circular migration. And when we talk about immigration, a lot of people tend to assume there's sort of a static process, right? Like people are just coming from Central America to North America, and especially the United States, or they're just coming from North Africa and the Middle East towards Europe. But as this graph shows, the nature of migration is circular. First, it's massively complex. All sorts of people are going to all sorts of different parts of the world. So we can see here people from, Afghanistan are going to multiple regions. People from India are going to places as diverse as the United Arab Emirates, the United Kingdom, the United States, and Canada. People are moving between Australia and New Zealand. People are moving between Thailand and Myanmar. And countries are arranged around the circumference of the outer circle of the arcs here in order to describe the trajectory of immigration flows going one way or the other. The big takeaway from this graph for me is that immigration is not just a story about people going from poor countries to rich countries, even though that's a story we often hear. People also often return to their home countries after working in other countries. And some people go back and forth so often that sociologists have invented a new term to describe them, quote unquote, transnationals. There are even communities in places such as the Dominican Republic that are almost wholly supported by migrant communities of Dominicans in the northeastern United States in places like Boston and New York City. So what does all this have to do with the Latino health paradox? Remember, we're trying today to explain why Latino and Hispanic immigrants in the United States tend to have better health outcomes than non-Hispanic whites, even though they have less wealth and less access to insurance. Well, the intuition here is that people may migrate to the United States when they're young and healthy, but then return home to their original countries when they get old. What would the consequence of this be? It would mean that we would not count their deaths in the United States, and we would exaggerate the overall life expectancy of Latinos as a result. And to the extent that people tend to acquire more health conditions as they age, many of those other conditions like cancer, diabetes, and others might have only appeared after people had returned to their home countries after spending much of their young, healthy lives in the United States. So that's hypothesis number 2, circular migration. A third hypothesis draws upon the theory of acculturation or assimilation. These are very loaded terms, and sociologists have often argued that we should revisit the use of these terms. But let's talk about what sociologists mean when they use these terms first. So this image is sort of showing a classic dilemma faced by a lot of people from immigrant populations in the United States. The idea is that one has to sort of choose whether to hold on to their ethnic identity or assimilate or acculturate into the white mainstream. And along these lines, people often have a lot of normative or ideological discussions about whether people should assimilate or whether the US succeeds precisely because it is a melting pot that has incorporated so many different immigrant groups. And if we observe political discourse today, you can see these two arguments lining up pretty neatly along the Republican and Democratic parties. But regardless of the normative overtones of this debate, regardless of whether people think immigrant populations should have to relinquish elements of their, you know, ethnic or ancestral backgrounds in order to become part of American society, we can also look at the reality of whether people are actually doing this, regardless of whether they think they should do this. And we tend to think of this as an American problem, that America is the melting pot and sort of the rest of the world is not so diverse, and America has a unique sort of experiment. Sometimes we use that term to describe the American project, right? The American dream, the idea that immigrants from anywhere can succeed. But as we look at other parts of the world, we can pretty clearly see that we are not the only country to accept a large volume of immigrants, especially after the breakdown of colonial empires in the mid 20th century. So you have folks going from sub-Saharan Africa to Europe and Australia, people going from South Asia to the Middle East, people going from South Asia to Europe, people migrating from East Asia to Europe and the United States. Really, we see migration exploding in the 1960s onward as so much of the world experienced decolonization, and also the center of gravity, economically speaking anyways, shifted towards the United States and Europe, and many migrants came to these places in search of a better life, regardless of whether or not they planned to change their culture or whether they planned to assimilate. Let's take a bit of a detour. We always talk about the US a lot in this class, and I'm always telling you that I want to tell you a lot about the rest of the world. And so we're looking at a non-US context here, but I want to ask yourself, where do you think this is? Take a guess. My guess is that you did not guess France. Sometimes ideological arguments about the need to resist assimilation champion the success of the US vis-a-vis other countries, such as France, which have a strong emphasis on assimilation. In fact, in France, all immigrants born in the country are offered citizenship and actively encouraged to embrace the French way of life. Learn the French language, learn the French culture, learn to eat escargot. No, just kidding. But this is pretty different than the US, right? In the US, we're sort of often described as, a group that succeeds because of its diversity. And in France, there's so much emphasis on accepting the French way of life, accepting the French culture. And the French believe so strongly in this that they once proclaimed themselves a race-blind state. It's actually illegal in France to measure someone's ethnicity. That can be shocking if you're coming from the US context, where we study race so enthusiastically. Why is it illegal to study race in the US or study race in France? It's because the French believe so strongly in the idea of France, the idea that anyone could become a French person regardless of race or creed. The principles embedded within the French Revolution, liberty, equality and fraternity. The idea was that anyone could become French if they accepted those ideals. But as this picture of recent riots in France shows, the reality has often been much different in France, and immigrant groups are by and large doing much less well than non-immigrants, especially immigrants from former French colonies in North Africa and sub-Saharan Africa. The same is true in Germany. But unlike France, Germans some time ago decided that you need to have German blood in order to obtain citizenship. They changed this policy recently, but before they changed it, the result was that immigrants had a sort of permanent outsider status. So if you came from Turkey, and Turkey was a country which sent a lot of migrants to Germany through guest worker programs where immigrants were recruited to help bolster German industry, which was failing after the Second World War, they were never offered citizenship. And they led a sort of second-class life and were expected to leave Germany, or even in the second and third generation when families, you know, stayed in Germany. They were not awarded German citizenship, and many people began to worry that this would cause non-immigrant populations, especially the Turkish population, to develop sort of separate societies. Why would you learn German when, you didn't even know if you would be accepted there or would be able to stay there? And obviously, all of these issues have become far more heightened and urgent in the context of the current refugee crisis throughout Europe and especially Southern Europe. Now, how do we measure whether a country is sort of good at assimilating immigrants, regardless of whether we think they should assimilate immigrants? We can talk about whether immigrants come to enjoy the fruits of a country where they go. So here's a multi-pronged indicator called MyPacs, and this takes into account all sorts of things about the policies that different countries use when they select immigrants. So the black countries here are countries that have extremely unfavorable policies towards immigrants, and the pink and the sort of dark blue have sort of mostly favorable or halfway favorable policies. And what we can see here is a lot of the Northern European countries, the Nordic countries, the US and Europe tend to have very favorable policies that promote, for example, immigrants obtaining citizenship. But in a lot of Eastern and Southern Europe, the story is much different, and it's much more harder for immigrants to integrate, and they're denied access to things like welfare and other state services. The map I showed you on the previous slide was created using an index that looks at a number of factors, such as the provision of social services and other integration measures. And you can see here that the US does pretty well. Not quite as well as Sweden, but, pretty well. And, we've gone on a little bit of a detour here talking about how countries sort of have differential success at incorporating or assimilating immigrant populations. But the theory of assimilation or acculturation is not used to study the Latino health paradox in a normative manner, in an opinionated manner, or in order to make judgments about whether Latino populations should assimilate. Instead, theories of assimilation in sociology are more concerned with the processes themselves. That is, whether assimilation is occurring, regardless of whether people think it should. The theory holds that assimilation is a somewhat inevitable process that occurs in varying degrees, whether we like it or not. As immigrants spend more time in a country, and particularly as they have children who grow up in these receiving countries, they tend to relinquish more and more of their cultural heritage and become more similar to the mainstream. And this gives us a definition of assimilation. Assimilation is the social processes that lead immigrant populations to become similar to native population in terms of both socioeconomic and cultural characteristics over time. Now, this assumes that immigrant groups are becoming more similar in sort of a positive manner. They're getting wealthier and they're sort of sharing a vision for what the country should be with the majority group. But sociologists have also discovered that occasionally downward assimilation occurs. And downward assimilation refers to the social processes that lead immigrant populations to become less similar to native populations in terms of both socioeconomic and cultural characteristics. So sometimes, across immigrant generations, when an immigrant family has children who have children and they have children, we see that across the generations, instead of moving up the economic ladder, they tend to move down. And this is not true of all immigrant populations. Certain groups, particularly South Asians and East Asians, tend to experience strong upward assimilation. But in certain cases, we see some groups experience downward assimilation. There's a variety of explanations that have been presented to explain this that we won't have a chance to get into in this lecture, but you'll read about a little bit about in the context of the reading we're going to do on the Latino health paradox. But I wanted to familiarize you with the idea that assimilation can be both sort of positive and it can be downward or negative, not in the direction where people are becoming wealthier or more integrated. And lastly, sociologists have suggested that assimilation can also be segmented. So here, the social processes that lead immigrant populations to become similar to native populations occur in some, but not all, socioeconomic and cultural characteristics. So immigrant populations sort of make decisions, or perhaps the society that receives them interacts with those decisions, creating a kind of segmented assimilation where it's not an all or nothing game, but different groups assimilate in different ways towards different ends. And here we can see, if we look across all immigrant groups, that socioeconomic assimilation tends to happen. So this does not account for the cultural dimensions of assimilation, whether people should learn English or accept, the American way. But here what we're seeing is that second generation immigrants, people who have immigrant parents, but they themselves were born in the US, they're less likely to be in poverty, they have higher incomes, they're more likely to own homes, and they're more likely than the entire population to go to college. So now let's look at the socioeconomic integration of Latino immigrants, because really what we care about today is how the theory of assimilation may or may not help us explain the Latino health paradox. Again, why Latinos tend to have better health outcomes than non-Hispanic whites in the US. And as this chart shows, second generation Latino or Hispanic immigrants tend to have higher incomes, though they remain generally lower than Asian immigrants and Black immigrants from the West Indies or Sub-Saharan Africa. By the way, we don't have time to do this today, but examining Black immigrants is a really interesting way of teasing out some of the effect of these outcomes. On average, Black immigrants from the West Indies and Africa do significantly better in terms of socioeconomic outcomes than African Americans. And if you're interested in learning more about the role of culture and assimilation in this process, you might be interested to read the book Black Identities by the Harvard sociologist Mary Waters. But our focus today, again, is on Latino and Hispanic immigrants. So now let's look at college completion. Once again, we see second generation Hispanic immigrants are making gains here, though they pale in comparison to Asian and Black immigrants. So second generation Hispanic immigrants are getting more education, but nowhere near as much as Asian and Black immigrants. Similarly, second generation Latino immigrants are much more likely to enter high paying professional or managerial positions, though their overall rates of integration in this dimension are significantly lower than Chinese and South Asian immigrants. So overall, socioeconomic integration seems to be helping, but it's nowhere near on par with other immigrant groups, and it leaves Latino and Hispanic immigrant populations, even in the second, third generation, behind non-Hispanic whites. So let's look at another hypothesis, and here we're going to draw upon culture and identity. We've used the term culture and identity in many different ways in the class so far. We talked about social identity theory when we talked about social psychology, and we talked about cultural capital when we talked about social inequality. And these are two terms that are defined in different ways in sociology. And in the study of immigration, we tend to use a somewhat different definition of culture and identity. And to understand this, we're going to have to take a brief detour into the history of sociology. And we're going to go all the way back to the German sociologist Max Weber, who's broadly considered to be one of the founding figures in sociology. We read about him really briefly in one of our early readings. So Weber famously argued that culture explains why the American Pilgrims, which is who we're looking at here, survived such dire circumstances to become the richest country on the planet. So how did a group of religious refugees who arrived on Plymouth Rock, mostly desolate, how did the United States, which had such humble beginnings, become the richest country on the planet? We don't have time to talk about Weber's famous book, The Protestant Ethic and the Spirit of Capitalism, so I'll give you the brief version. Weber argued that it was because our belief system, or the belief system of the Protestants, who and the Protestant refugees who arrived, Puritans, in the early days of our country. Their belief system made them experience anxiety about the afterlife, which led them to act in a manner that generated wealth, because generating wealth was evidence that they were predestined to go to heaven. And the reason we're talking about this today is that this foundational insight linked how people think to how they succeed in terms of socioeconomic status. So the idea that our culture, our way of seeing the world, in this case, pervasive concern that you are among God's selected. What do you do if you're worried about whether you're going to heaven? You act in ways in this life that give you evidence that you might be going to heaven. In this case, working hard, accumulating wealth, as in order to help convince yourself and relieve your anxiety that you are in fact among the predestined, which is a source of anxiety that people in other sects of Christianity arguably don't need to face. So as we're thinking about culture and ways of seeing and sort of ways of thinking, one thing that's really important is language. And as you can see in this graph, language retention, teaching your kids your language if you're an immigrant, is overall more important for Hispanics than Asian Americans, according to these data from the Pew Research Center. But the same survey also asked a potentially more relevant question, which is, are there ethnic differences in the percentage of people who think of themselves as, quote, typical Americans? So are economics and culture similarly linked in the integration of immigrant populations, whether they think of themselves as typical Americans? Here we can see that Hispanics and Asian American immigrants look pretty similar. In the first generation, about a third of immigrant groups from these categories think of themselves as typical Americans. And by the second generation, almost two-thirds think of themselves as typical Americans. Okay, so we've taken some detours through culture, economics. We talked about assimilation, downward assimilation, segmented assimilation. Earlier, we talked about two more straightforward hypotheses like circular migration, and we talked about the healthy migrant hypothesis. But I want to take us back to health. And, do all of these gains in socioeconomic status, right? As Latino immigrants are in the US longer, they're becoming more wealthy. And, in a previous lecture, I told you that wealth is a strong predictor of health, right? Socioeconomic status tends to really impact health. And as Latinos are getting wealthier across generations and better educated, this should also mean, right, that Latino immigrants are becoming healthier across immigrant populations. Interestingly, though, this is not the case. Foreign-born Latinos are much less likely to suffer from obesity, hypertension, smoking, heart disease, and especially cancer. Similarly, foreign-born Hispanics from every country except Puerto Rico have lower levels of infant mortality. In other words, over each generation, Latino and Hispanic immigrant families tend to become less healthy. And we'll see in our reading for this week that this might be part of what we're calling downward assimilation, right? Assimilation, could be good. You could be entering into the wealth of a country. You could be, reaping the benefits of educational systems in a country. But if the country that you are assimilating towards also has unhealthy practices around health, for example, different styles of eating or different norms around exercise and so on, assimilating into those could make you less healthy. So let's go ahead and review our key concepts for this week. We're going to talk about not only today's lecture about the Latino health paradox, but also our earlier lecture this week on health. One of the first key concepts I want you to remember is that socioeconomic status has a very large impact on health. We looked at the work of Dr. Paul Farmer. We also looked at the work of the Whitehall study in Britain and showed that across generations, socioeconomic status seems to explain a huge amount of health disparities. But we also learned last class that the causal relationship between socioeconomic status and health is highly complex. It could be that, socioeconomic status shapes negative health outcomes, or it could be the other way around, right? If you become unhealthy, then it's hard to keep a job. It likely involves the interaction of psychological and material factors, specifically the uneven distribution of economic resources and knowledge about health. These fundamental causes, to use the term of Phelan and Link, whose work we read before this class, they don't erode over time. They are reproduced because health is dynamic, and the recipe for good health is always changing. So make sure you know what fundamental causes theory is in inequality in health. And today we talked about how there are significant differences in health outcomes across not only SES, socioeconomic status, but also race and ethnicity. And though African Americans have far worse outcomes than whites in the United States in terms of health, and are generally poorer than whites, Latino immigrants have better health outcomes than whites, even though they are more likely to experience poverty and less likely to have health insurance than African Americans. Sociologists have hypothesized that the Latino health paradox results from selection, that's the healthy migrant thesis, circular migration, the idea that people spend their healthiest years in the United States and then return to their least healthy years in their home countries. And we also talked about acculturation or assimilation, as well as downward assimilation and segmented assimilation. And assimilation is the extent to which immigrant populations come to resemble majority populations, but downward and segmented assimilation can also occur. And when we start to tease out the cultural assimilation vis-a-vis the socioeconomic assimilation, as we did towards the end of this lecture, we see that that can have negative consequences for health. So today we're going to read a really interesting, or after today's lecture, we're going to read a really interesting lecture or reading called Do Healthy Behaviors Decline with Greater Acculturation? Implications for the Latino Mortality Paradox. And if you've enjoyed today's lecture and are interested in learning more about immigration and health, I highly recommend you check out a class by the Duke sociologist Janan Ghazal-Reed, who teaches a variety of classes on immigration and health. And up next in Soc 110, we're going to be turning to a subject that I am particularly passionate about and really excited to introduce you to, and that is social network analysis. We're going to be using some new software to ask the question, who is the most influential person on Twitter? And I'll be introducing you to some of the tools that we use in the polarization lab where I work to study this issue and to learn how to systematically and scientifically measure social relationships and learn how the geometry of our relationships to each other can determine all sorts of different outcomes we care about, even health, like the subject of today's lecture. I'll see you soon.